cardiac arrest basically means your heart essentially is not pumping blood to the body. So you usually just present with unresponsiveness. Suddenly you just can slump over and you just can't respond. Nobody can rouse you. Your breathing is affected. Your pulse generally stops. These symptoms can happen again this can happen without symptoms previously. But as we know, a lot of cardiac arrests come from cardiac disease, and a lot of patients may have precursor symptoms. Men often have chest pain, women can have shortness of breath or chest pain, nausea, sweating, those type of symptoms before their arrest happens at times. Most cardiac arrests are out of the hospital, so the majority happen at your home or at football games and sports events, and the chance of recovery is pretty low, but you triple your chance of that patient recovering by administering high-level CPR immediately. So it's pretty simple. First, you see somebody collapse, you basically have to check for responsiveness, so you make sure that they're roused, or if they're not rousable, you immediately ask for help so somebody can call 911 or get an AED or a defibrillator, and then you immediately start chest compressions. So high-level CPR is very important. You have to push out the center of somebody's chest, and you want to push hard enough that there's excursion about an inch. And you have to do it fast. 100 to 120 beats per minute, or pushes per minute, I guess, is what's recommended. So helpful mnemonic, because people are confused how fast they should go. The song from the Bee Gees, Staying Alive, kind of helps you pace yourself so you're getting effective CPR to the patient or the victim. So let's talk through a scenario where you witness somebody collapsing, and the first step is you assess for any signs of responsiveness, and if they do not respond, you shout for somebody to get help or call 911. You want to activate the emergency system and get an AED or some way of defibrillating them from likely a bad cardiac rhythm. And immediately after that, you get on the person's chest and you deliver the center of their chest effective CPR. So you are pressing with an excursion of at least 1 inch for older kids and adults, and you do it at 100 to 120 beats a minute. I do see a lot of reluctance. I think part of it is nobody wants to potentially be sued if they break somebody's ribs. There are also somewhat this inappropriateness of maybe giving mouth to a woman or pressing on her breasts. That sometimes keeps people from being readily available, even if they know CPR, to administer it on a female patient. But it's important to know there are Good Samaritan rules in every state of this country, basically protecting you if you're trying to save somebody's life. Generally, that lawsuit is not going to result in anything. So it's important without hesitation to do CPR. And honestly, for most people now, the guidelines have changed such that, initially there was 30 pushes on the chest and then 2 rescue breaths. That actually, we've seen that the results are the same if you don't do the rescue breaths. So I think more of an incentive for people to kind of help and not have to worry about giving rescue breaths has helped encourage people to kind of be the hero in the situation more.